across the country. When the technical committee decided that we were coming to launch the program here, I was a bit concerned. So I asked CS Duale, why are we going there? We should go to a small hospital in a place like Murang'a or in Kitui, which is public. And we discussed and agreed that because there's been a lot of propaganda that we are downgrading the cover and it will only be confined to public hospitals, we say there's nothing wrong with doing it in a private hospital and in the presence of public hospitals here, so that we debunk these myths. You know, there are too many loud characters out there who are making it difficult for Kenyans to appreciate the service that we are having, and we wanted to do it practically. And we've walked through these hospitals, seen the facilities, seen the cover, seen the fast tracking areas. And I want to assure our police officers and the prison service officers that you will get a more enhanced cover. You are getting an enhanced cover, and you will access all facilities in Kenya, private, public, or faith-based. And therefore, there will be no discrimination in terms of the institutions that we are going to access. That is a major transformation that radically improves our officers' access to health services as they serve our nation. Further, this scheme is not the standard shift package. It carries an enhanced benefit package covering services such as advanced surgeries and air evacuation, among other services, which benefit our officers who face occupational risks that few others do and are entitled to. During Jukwaa la Usalama forum that we had across the country, I must say that in some instance, there were cases, and you saw, because it was live covered functions, there were cases where the constables or corporal officers across the country were saying, why are we being discriminated in terms of the facilities we are accessing? Is there malaria for the IG and a malaria for a constable? You know, now I want to tell them, here is the cover. You can go to any facility and you can be taken care of by this enhanced SHA cover. I want to also assure our officers that we are a listening government. And when we went around the country to listen to your views and see the type of cover you had and reflected on the cover that was there during these negotiations for transition to SHA, we have factored in all your views. They were not in vain. They were for purpose of being onboarded. The history of medical insurance for our uniformed officers have been fraught with pain. We entrust the health of our officers to private insurance consortiums, and in return our officers were met with closed doors, capped limits, and discriminatory practices. From my interactions with our officers and the presentations they made across the country during Jukwaa la Usalama forums last year, one thing was clear. Our uniformed officers deserved a better health cover that is tailored to their unique needs. As a result, the new scheme provides a more comprehensive and sustainable medical cover, including last expense benefit for officers and their dependents. Under the SHA framework, officers and their families will benefit from an expanded and comprehensive package covering outpatient and inpatient services, dental and optical care, emergency services, specialized treatment, and annual medical checkups. When Mercy spoke here about emergency services, I hope, and she told us, and I'm sure CS also has been saying this, but let me also lend my voice on this one. The medical treatment is free in Kenya. So if you find somebody who has been hit by a motorcycle, you know, any emergency that is life-threatening and is an emergency, it's important for all Kenyans to know that you can go to any hospital in Kenya and be treated freely for 24 hours by SHA. to make sure that you are stabilized and protected. And our officers are going to be benefit from this immensely, considering the kind of work they are going to do. Besides their enhanced cover, also in cases of emergencies, them and their families are going to be able to benefit from this. We have also there has been an insistence on the fact that we are not using the checkups. I want to implore all prison officers and police officers with your families, please take advantage of these checkups that we are being given. 2% is far too low. It's important for us to, it becomes cheaper if you are able to treat any disease early, and there is nothing to fear. I asked one friend of mine why he doesn't go for checkups. He told me that the scheme also includes provisions for overseas treatment without exclusion, access to emergency and critical care, and an expanded list of dependents. The enhanced benefits outlined today are a game changer for the morale of our officers, knowing that they are guaranteed comprehensive care, including difficult parts across the country. Indeed, the inclusion of intravitreal fertilization, IVF, overseas treatment, and structured ex-gratia framework proves that this government cares deeply about the holistic well-being and the dignity of the officers and their family. And importantly, the last expense benefit ensures that that should the worst happen in the line of duty, the families of our fallen heroes will receive immediate, seamless support. I am gratified to know that SHA has ensured continuity of the care. Any officer or dependents already admitted to hospital will continue receiving treatment without interruption. Where an officer is receiving treatment at a facility not yet contracted by SHA, arrangements will be made to facilitate transfer. No one will fall through the gap. Benefits, health care for our officers is not a benefit we grant grudgingly. It's a debt we owe them. The least we can do for them for the service they render to our nation. When an officer is injured on duty or falls sick or needs specialist care, the state must be ready. That is what that is what today is all about. And I want to say that before I make the rest of the conclusive remarks, I must say that CS, we have also consulted with you on the question of the national to shift. And I think that is possible based on our conversation with the IG. We have also, and as a witness, the IG has downloaded a much broader reform agenda, and it's important to state the context. These reforms are aimed in restoring morale and operational efficiency. First, because phase 3 of the salary adjustment for officers takes effect on 1st July 2026, building on the enhanced operational efficiency. In addition, we have promoted to the next rank, and corporals who have served in the same rank for more than 10 years have equally been promoted following those recommendations of the Jukwaa Usalama. On staffing, police and prison training, and should be able to pass out around August, late August, September, and nearly 4,000 is rebuilding capacity deliberately and at a scale to match the need. On housing, plans are underway to build over 17,000 houses for the police and over 28,000 for our prison officers. Decent accommodation is not a luxury, but part of what it means to treat our officers with dignity. You must have seen that last night there was a fire incident in Langata Women Prison, and it is very demeaning actually to see the kind of structures we are calling houses that got burned. They are literally shanties, and I'm happy to note that because the procurement process is going on and is almost complete, 200 houses will be built from this month in that same Langata Women Prison and across other prisons across the country. On modernization and accountability, we are enhancing the integrated command, control, and communication center from the IC3, which is Command, Control, and Communication, to Command, Control, Communication, and Computation, into a more advanced IC4 platform that incorporates high-performance computing capabilities and artificial intelligence driven with data analytics. This next phase will strengthen our ability to predict, detect, and respond to security threats in real time. In addition to the Central Command Center, we'll roll out digital operations hubs and CCTV surveillance across 6 major towns in Kenya. That includes Nairobi, Nakuru, Kisumu, Mombasa, Nyeri, Eldoret, among others. Further, we are equipping all police stations with modern ICT infrastructure, including CCTV systems, to enhance operational efficiency, accountability, and transparency in the service delivery. We are also improving mobility of our officers across the country. The IC4 contract is being negotiated, and by the end of this month, we should be able to sign. And in 6 months, we will be having digital occurrence book, a digital OB. You will not need to go to a police station to report a crime. You can report using your tablet at the comfort of your house to make sure that we understand what happens in the country. Taken together, pay, staffing, housing, legal framework, technology, and now healthcare, this is what government that takes its security forces seriously looks like. On this note, I must send this stern warning to both rogue healthcare providers and any corrupt elements within our ranks. Anyone attempting to steal public money, the Directorate of the Criminal Investigations will work closely with SHA to foolproof this scheme. All the fraudulent claims will be investigated to their punished. As I end, I want to once again commend the Ministry of Health and SHA team under the leadership of the very energetic CS Aden Duale for the hard work they have put into this transition technical process, and also the Public Service Office of the President, represented by the Deputy Head of Public Service, and to the healthcare providers, this hospital, Avenue Hospital, and across all the contracted facilities who are ready to serve. I say asanteni sana, and to our officers, and I must say this, the President asked me an IG a very difficult question 2 days ago, that after we have done all these things we have asked, what then stops us from delivering better services to the people of Kenya? And I want to ask the officers here that it is important for us to reciprocate to the people of Kenya, best with better morale. We are not asking anybody for a bribe, because Kenyans are paying taxes for us to serve them, so that we can become a modern police service that is able to serve the people of Kenya. Kwa hayo na mengi, asanteni sana na Mungu awabariki.